exam.
Thank you. I want to start off by thanking Julio and the organizers for putting on a great workshop. So today we've heard calls for innovation and calls for cost effectiveness, and today I'm going to talk about some phylogenetic tools that we've developed in BC for, that I think are innovations that can help us be more cost effective. I also want to start off by saying that, I'm here talking, but this is work that's done by myself and many other people, especially Dr. Art Poon, Dr. Richard Harrigan, and Dr. Montana. So a bit of background about BC, which is in the corner up there, the red province. Historically, we had the highest rates of new HIV diagnoses. But if you look at the blue line on the graph, we now have the lowest, and that's associated with a marked decline, or it's a marked decline in the number of cases, but it's associated with subsidized heart and treatment as prevention. So, but what we do have is hotspots cropping up, and these are hard to find, but one tool that we can use to find them is phylogenetic clustering. And so here we take advantage of the fact that HIV evolves very rapidly, and thus infections that retain significant genetic similarity are likely related by recent transmission events. And thus clusters of genetic similarity infections can represent localized outbreaks of HIV. So the blue circle on the top corner up there circles a cluster that may be a transmission cluster. But I want to also start off by saying that a network of genetic similarity is not a transmission network. We can't ever really exclude the possibility of intervening unsampled infections. So thus, the branching events in a virus phylogeny do not represent transmission events. And this is one reason that we're considering clusters of size 5 or greater. So things are considered at the group level rather than the individual level. Okay, on to our monitoring system. So we have over 32,000 HIV genotypes in our database from nearly 9,000 people, and that represents nearly 75% of the estimated HIV prevalence in the province of British Columbia. These genotypes are all automatically linked to clinical, demographic, and epidemiological variables, and they're de-identified prior to analysis. So every single day, we regenerate the phylogenetic tree of BC's HIV epidemic, and then we break that into clusters. And we're currently tracking 170 clusters. So what does that look like? Well, some people tell me that looks like vomit on a page. It's really hard to actually extract any information from that in itself. So what we do is we build these reports which are specific to each cluster. And so let's take a second and look at this. So the size of those circles represents the viral load. If there's a line around the outside, it represents a new case. And the color, if it's green, it means it's not drug resistant. If it's red, it means it likely is a case of transmitted drug resistance. And if it's orange, it represents intermediate resistance. And the plot in the upper right corner is sort of a tracking of what's happening to that cluster over time. We also have this all linked to geography, so we can say where these new cases are occurring. And so these reports are given to the directors of the CFE, the British Columbia Centre for Excellence, to the BC CDC, and to our public health authorities. And so that's great, so they get a nice bunch of pretty pictures, but what can they actually do with that information? I'll give you an example of one cluster. We'll call it Cluster 55. So on the panel on the left, we have what we saw between April 2014 and June 2014, and you can see a lot of large circles representing people that have high viral loads. A lot of them have circles around the outside indicating that there are a lot of new cases, and very worryingly, there's a lot of transmitted drug resistance that seems to be showing up there. So the decision was made to do a formal outbreak investigation. And so then there was some follow-up, and we had, for 9 individuals, 8 with transmitted drug resistance so that we could ensure that they were linked to care. And prior to that follow-up, only 5 of 9 of those people were on antiretroviral therapy, and only 1 had a suppressed viral load. But by the end of the follow-up, 8 had started taking therapy, and 6 had suppressed viral loads. So this is the picture that we saw next. So between July 2014 and January 2015, you can see those big circles have actually shrunk down into little circles representing low viral loads, and there are not a whole bunch of new cases cropping up there. So we're able to do a targeted intervention here and partially solve the problem. So we saw a marked reduction in transmitted drug resistance. It's difficult to attribute causal effects to this intervention without a proper control group, but this seems to suggest that prioritized cost-effective delivery of HIV testing and treatment to populations with the greatest risk. So our next steps, we want to try to expand this system of monitoring to other provinces in Canada. And we're also doing a national level study looking at using these same kinds of tools to look at clustering across the country. So now I'll show you, I'll show you another vomit on a page, which is, now I've changed the colors so that they represent the different provinces. So green is British Columbia, blue is Alberta, orange is Saskatchewan, red is Ontario, and yellow is Quebec. And it's hard to really extract much from that big picture there, but you can see that the big, large clusters are predominantly the same color. At least that emerges immediately. If we look a little more closely, we can see that yes, most of the clusters are very province-specific, but there is a little bit of mixing between the provinces. So the conclusions are that most of the clustering occurs within provinces through local transmission, though there is some interprovincial clustering. Provinces with lots of data display these similar patterns where you have some large clusters that are predominantly IDU and lots of smaller clusters. And so the take home from all of this is that these phylogenetic monitoring tools provide practical, actionable insights about our HIV epidemic at multiple different scales that can allow us to do targeted interventions. Many acknowledgements, a lot of people and organizations have contributed to this. Thank you very much.